Dr. David Morris. I work here at the Tulalip Heath Clinic as a physical therapist, and I'd like to share with you all some tools that physical therapists and respiratory therapists have been using for decades. The recent COVID-19 pandemic has really highlighted the importance of physical health, but also lung health. This virus focuses mostly on lung tissue, which can lead to more mucus production and difficulty breathing. Mucus typically acts like a sponge for bacteria and particles, which all gets transported to the top of your throat and either swallowed or spit out. But as we get sick, our bodies will produce more mucus, which often sits in our windpipes and sometimes deeper in the lungs. And this is more dangerous, especially when the mucus is loaded with bacteria that doesn't exit the lungs. This will lead to infections or limited airflow. The impact is worsened when you already have cardiovascular and lung-related issues. Such examples are COPD, asthma, cardiovascular disease, and diabetes. These conditions make it more difficult for proper healing and recovery. Breathing exercises are some of our best ways of preventing these harmful effects. And they've been shown to improve lung volume, improve activity tolerance, and reduce breathlessness. So here's some really great ways that we can build some healthier lungs. Diaphragmatic breathing. To feel your diaphragm, put your hand on your belly and sniff like you're smelling a flower. The lifting in your belly happens when your diaphragm contracts. To perform diaphragmatic breathing, attempt to breathe deep into your belly where you felt your belly lift. See if you can breathe in for 5 seconds and breathe out for 5 seconds. Pursed lip breathing. Take a slow, deep breath with your diaphragm as described above. Purse your lips as if whistling and slowly breathe out as if you're making a candle flicker. This will strengthen your diaphragm and breathing control, and should make breathing throughout the day easier and smoother. You have healthy breath control if you can breathe out with pursed lips for 20 seconds. Summed breathing. Take a small breath and pause for 2 seconds. Then repeat this until you are unable to inhale anymore. You may quickly exhale. This will allow air to get behind any mucus blockages in your lungs and push it out. This should reduce the risk of pneumonia or lung infections. Huffing. Take a large breath and hold for a few moments. Then forcefully push the air out of your lungs as if you're saying, "Huh." Huffing will push mucus from deeper parts of your lungs and make it easier to cough it out. Always pair this with coughing, just not around other people. Walking. Inactivity and maintaining the same positions increases your risk of pneumonia or other respiratory infections. To reduce this risk, especially if you feel you're getting sick, try to change your position often during your waking hours. You should never be sitting in a position for more than 1 hour, and you would benefit from standing and walking for 5 to 10 minutes every hour. We've also found that people who walk 30 to 45 minutes, even 3 times a week, can improve their lung volume and breath control significantly. During exercises, monitor for unusual symptoms such as chest pain, lightheadedness, confusion, prolonged shortness of breath, or inappropriate breathlessness. Be sure to call your doctor or go to the ER if these symptoms seem to persist. So these exercises don't work for everyone the same, but I hope that they can be useful for you all in these times. I'm praying that they'll keep you all more safe and that you will feel like you have more power to control your health in these times.